IBM, we have Dan Morales, the Senior Offerings Manager, Unified Governance and Integration, also one of the early members of the team that helped create IBM's Unified Healthcare Data Model. And Dan is engaged with IBM's data governance and business analytic offerings leaders to address key healthcare industry needs. From CitiusTech, we have Abhay Singhal, the Vice President of Provider and Healthcare Services Market, with 19 plus years of in various aspects of healthcare and enterprise architecture. Abhay is also a member of the executive team at CitiusTech and heads account management, sales, and partner channels for the provider and healthcare services market. Before we begin, just a quick note on handling questions. I request you to please submit your questions using the questions pane on your control panel. You may send in your questions anytime during the presentation and address them, and we will address them at the end of the Q&A session after the presentation is done. Without further ado, I will turn this over to Abhay to share with us the learning objectives.
Thanks, Bruce. So in terms of the learning objective for the webinar today, we're going to look at how payers and health plans, health systems, they bring the data and technology together to form a very strategic initiative and driver for value-based care. In the webinar, we'll have perspective from 3 different groups. So as in any institute, we'll have groups from technology partner, which is IBM. They'll be talking about how a unified data governance and a data model brings all of these different initiatives together. So Dan is going to share his vision on how not only clinical operational, but when you look at supply chain, pharmacy, look at behavioral data, how all of that comes together and brings a platform for folks to use. And I'm going to take maybe 10 minutes to talk about how, as a solutions and services partner, how we look at technology to play a role in enabling a lot of these and kind of share some success stories on what are others doing in the market. It's going to give you an overview across the market. And then we'll have Shashi talk about the business use case on how Baylor Scott & White has taken all of these pieces and enabled that into a success story. So with that, I'll hand it over to Dan to cover the first part of it. Dan?
Thank you, Abhay. So IBM has been bringing data governance, data management, analytics, data integration, acceleration to industries for over 25 years. We've done that by creating best practice industry blueprints, content gleaned from thousands of engagements with clients all around the globe. And we've created acceleration artifacts for each industry, spanning banking, insurance, healthcare, and others, and able to do this by having a lab that is dedicated to industry model and industry expertise to influence technology, to influence our solutions, and be able to engage at the industry use case level and speak to our clients from their own struggles and address those with technology and information and concepts. These areas that our industry models offer are in terminology and concepts, data structure and designs, and KPI and report content. So these are measures that are taken from standards for healthcare, for example. In HEDIS, you've got effectiveness of care and the utilization and those kinds of measures. These are predefined within the offering to help you address those analytics and identify what data footprint items you would need to be able to meet those measures. So the Unified Data Model for Healthcare has been well received. About 10 years ago, we had a couple of different offerings that I'll describe on the next slide, but the artifacts, to go into a little bit more detail, include supportive content. These are mappings to healthcare standards that you might be familiar with, FHIR, HEDIS, VCF. There's so many different ones that we've mapped to be able to allow clients who are using these standards, who are needing to move data into our unified model, a map, a guidance, an accelerator to be able to address those capabilities with ETL and so forth. We also have a business vocabulary that is healthcare specific, enterprise-wide, and it creates a business level and technical level point of agreement where the industry is speaking the same language, have the same meanings across terminology, across measures, analytics, and across the data footprint and IT information assets. We also have the logical models. These are conceptual, transactional, and dimensional models. You can use these for integration platforms, data lakes, data marts, and so forth and so on. We have clients all over the globe who are using these models. We've had great success, 75 plus clients in North America, Canada, the UK, now going into the Middle East and Asia. Next slide. So a number of years ago, we had a couple of offerings. One was for the health plan or healthcare payer, and we also had one for the healthcare provider. So you imagine, you had claims and health plan coverage and plan member coverage, legal action and claim fraud, and those types of data set domains covered in a health plan offering. We also had, the clinical data, the encounters and clinical findings, and all that you would find for the clinical care and treatment of patients in our provider model. And as IBM saw the industry converging, payers, providers converging a number of years ago, trying to meet the demands of the triple aim, really, it's proven quite a challenge, as you all know on this call. And our clients were struggling to bring the data domains together, to run a combined enterprise as one, to have a holistic view of really a consumer, a plan member and a patient, and be able to see them as one and be able to drive operational insights, to drive predictive analytics, to drive all of the things you need to run your business as one business while you're really handling two different areas of healthcare, the payer and the provider side as well. So being able to bring that to fruition required a new model. It required a convergence at the technology and solution level. And so the Unified Data Model for healthcare was born a few years ago, started with version 9.0. We took thousands of artifacts. We can go to the next slide here. Took thousands of artifacts from the payer model and the provider model. These are everything from the vocabularies, the definitions, there's synergies, there's conflicts when you try to merge these kinds of items, and being able to get the right best practice definition is going to make our clients successful, and the right breakdown of subject areas. It was quite a challenge. It took us 8 months to take thousands and thousands of artifacts, recreate diagrams, redefine new relationships, and even expand some areas of coverage. So you can see here an example of what we started with. The payer model had 26 subject areas of coverage. The provider model had 44 subject areas of coverage. And we took all of these, brought them together, and came out with about 49 subject areas total for the Unified Data Model for healthcare. It's quite a comprehensive model. Our clients have really been enjoying it and moving their projects forward. Some of them apply simply governance. They take the product and move it to governance solutions. Others are focused on data integration and moving into analytics. But really, IBM's view is one where the industry model, our healthcare industry model, is foundational. It really is strategic for our unified governance and integration platform, where we've got information server, we've got MDM, Cognos, and all of these tool sets that really work together in an integrated fashion to build that analytic data platform that takes you to the future, which is artificial intelligence, where every organization will really be using that more and more as we move forward. But beyond unified governance and integration, the industry model is also a foundational component of our Watson Health solutions, very capable solutions with integration points to help our clients who've maybe taken advantage of the unified data model, and they'd like to move into more predictive analytics, more cognitive analysis. They're able to do that seamlessly because we've focused around kind of a unifying solution, which is this best practice industry model. Next slide. So as you can see here, we have, the way we've been able to pull this off is by taking, the real benefit you get here is whether you use a portion of the data sets. We have clients that say, well, I'm only using 10% of the model. I'm using 15 or 20% of the model. The reality is, no matter what percentage of the model you use, you're getting 100% of the value, because the value is that being able to take core master data, take your patient data, your payer data, your supply chain data, consumer data, and move it into social media data and other areas, behavioral health content and genomics and so forth. And you take all these areas and with best practice and IBM's view from the different organizations we've worked with for so many years, taking them and creating a small subset of conformed dimensions that are properly related, that are properly integrated, and help our clients to build a fraction of the model, knowing that they will not have to rebuild, not have to recreate, not have to throw it away and start over. We've heard that story so many times from our clients who've tried to build their own models, build their own data infrastructure, and they've had to start over 5 years later because it's outdated, it's not meeting their needs. With the Unified Data Model for Healthcare, our healthcare organizations are ready. If the convergence moves, and we see the convergence moving into retail pharma, and CVS and Aetna just closed, right? So we see the convergence continuing, behavioral health clinics moving their practices into the clinical setting. There's so many areas of convergence that are still going on, and the Unified Data Model for Healthcare is meeting that challenge by staying on top of the industry and expanding to make sure that these new areas of are still being integrated properly for your ability to move into those areas, not paint yourself in a corner. Next slide, please. So we have an upcoming release. UDMH is not standing still. Since 9.0, we've had several releases, and we've continued to add. We'll be doing a session pretty soon. We have a major release coming out just around the corner. We're expecting it here within weeks. It'll be around the corner, and it's going to bring in more content for HEDIS 2018. It's going to bring in FHIR, the latest release that's out, version 3. Substance abuse, SAMHSA, KPIs, support, welfare programs, and so much more. So we're not standing still on the model, it's continuing, and stay tuned for that announcement and that information. So as I wrap up my portion here for today, I'd just like to say that IBM has a strong partnership with CitiusTech. We partner in technology solutions. They are a premier business partner with expertise and SMEs who are certified in IBM practice and IBM technology. We've been able to work together successfully with clients and deploy UDMH and reporting, clinical analytics, bring acceleration to projects, go into situations that have not been successful and turn them around and make them successful in many cases. You'll be hearing from Bader, Scott & White today as well. So we have a great relationship with CitiusTech. They also bring their own solution that is also integrated with Unified Data Model. There is a BI clinical application, and you'll be hearing more about that here from our next speaker. And with that, I'll give it over to Abe.
Sure. Thanks, Dan. Thanks for your inputs, right? So I'm going to cover take a few minutes to just talk about who we are as a solution and services provider. So just a quick corporate overview, we are 13-year-old, work only in healthcare, 3,500 plus individuals that come to work every day to just look at how different problems to solve. We have one of the highest net promoter score in the industry of 69, and have been seeing a growth of 30+% every year. So overall, it has been a great track record working with us over in the industry. One of the things that I wanted to just highlight from this is 3 years in a row we have been tracked in the CIT top 100, right, and going up in ranks. So I'll move over to kind of give you a quick glimpse of the different client base that we serve across providers, across payers, across medical technology, and across life sciences. I'll not go into any logo in particular, but one thing to really look at is as the world of healthcare is converging and evolving, it kind of gives us a unique perspective to look at problems not only from a specific domain. We are able to bring in the health plan expertise into health system, Similarly, lab expertise into a health system and other vice versa, right? So this really helps us to take a very holistic approach to this all. You'll also notice a lot of these customers are also joint IBM customers for us. And what we do for these customers, right, just to kind of give you a sense all the way from data integration and interoperability that you would see on the left, which has been our core competence from the very beginning. We're working with a lot of the customers and evolving them into this clinical value chain. And the way we define the clinical value chain is all the way from data integration interoperability to data management, onto performance management, which is all the clinical quality measurements of sort, moving on to predictive analytics and data science, and then to digital enablement. What really helps in addition to this is the layer in the bottom, and we have, as a part of our strategic investment into Fluid Edge Consulting, a set of very senior consultants who works very closely with our clients and partners to look at different areas of system implementation, change management, business process engineering, and others. So altogether kind of gives you a one-stop shop when it comes to healthcare IT needs. So in specific context of IBM and the technology and the partnerships that we offer, so I'll just touch upon a few of them. So we have platforms that Dan mentioned about BI Clinical. So this is the NCQ and CMS certified offering, which sits on top of your UDMH. You'll hear a little more on this from Shashi in the next section as well. At Scale is our big data offering that's again offered on top of IBM Big Insights and the big data platform. And then we have an integration offering called IDIA, which is our integration channel for bringing our data into UDMH. Along with this, what complements are a set of services. So we have by far the largest number of folks that trained on a couple of IBM technologies, including UDMH, Cognos, SPSS, PDA, Netezza, the newer ones, IIS, and others. And this really helps us to kind of get a good mix of services and solutions on top of the IBM offerings. Let me spend some time maybe on talking about the success stories, right? And these are very key not in terms of the logos, but in terms of the business problem that we are trying to solve. You'll hear more about Baylor, Scott and White in the next sections. I'll not go too deep into that. But our working with Baylor, Scott and White has been for past few years, and it has been looking at getting data from different environments into one place. We work with DaVita, which is a pretty large renal care reporting solution. And as a part of DaVita, we are moving their dialysis, CKD, ESRD data into one reporting infrastructure, which is sitting on top of UDMH. And again, technology-wise, we use a combination of data stage, IBM Cognos, and PDA there. And the key thing is that they cover roughly 500,000 lives there and report their solutions on 8 million visits per year. Presbyterian is a newer customer that we are working with. We are now integrating their clinical claims, RX prescription data across all of the different lines of business. And again, IBM's UDMH is used as a core data model there from data integration, data governance, and reporting. I wanted to highlight one of the use cases here on Centara Healthcare. So this is up in Norfolk, Virginia. And what makes them unique is that they're by far are the first customers to look at this modern data warehouse architecture on a cloud-based or Azure environment. So this is a case where we standing up a data lake environment to look at their longitudinal patient record and do effective population health management. The data warehouse on top of the Cloudera's Hadoop distribution here is on IBM UDMH, and that is something that is in works right now. I'll be happy to share more information on that in subsequent webinars later. Quest Diagnostics is by far our largest customer in terms of size of data that they have put on top of not only the data model, but the amount of data that comes streaming to them. So they roughly get 5 to 10 million messages per day and use a combination of, again, big data technologies, IBM Cognos and UDMH for their deployment. And last but not the least, right, so Centra Healthcare, we started working with them a few years back when they were due for their PQRS submissions, and they had a huge $6 million penalty at risk for submissions. We enabled them on using IBM UDMH again to report on their PQRS 2016 measures, integrated with various EMRs that you would see here, Allscripts, G, Cernicity, Area, Variant, and others. And that really helps, bring all of that data in one environment for them to do PQRS. And they moved on later to MIPS, macro reporting, and others that we are working with them. I hope this kind of gives you a flavor of how a technical solution is being used in various business contexts. And with that, I would like to pass it on to Shashi, and we'll hear a little more about how a specific use case is being enabled at Baylor Scott and White. Over to you, Shashi.
All right, thank you. Good morning, everyone. Before we go into the specifics of the technical work, just wanted to give you all a quick snapshot of who we are. So we are Baylor Scott and White Health. We came into existence through a merger in 2014 of two pretty historic, pretty big healthcare systems. So that's Baylor Healthcare System in the DFW area and Scott and White Health in the Temple, Central Texas region. And so we came into existence. We are now the largest not-for-profit healthcare system operating in the state of Texas with about 48 hospitals. And those hospitals keep growing. As you all know, this is the area we operate in, represents one of the fastest growing areas in the country. So we are growing definitely quite organically as well. And we have about 45,000+ employees in the company. Our annual revenue is inching upwards of $10 billion, with total assets of about $12+ billion. And so that's and we also are a true integrated delivery network. We are obviously a major hospital system. With a lot of over 1,000 access points, including a lot on the urgent cares, ambulatory care settings, clinics, so on and so forth. But importantly, we are also a payer. So hence the context for today's discussion is we are a provider and we are also a payer. We also have a large population health arm as well in our footprint. So that's a little bit of who we are. So let's look at we have a Venn diagram here. As you can see, we are a provider, as I mentioned. We are also a payer, and because we are operating as both, this notion of Payviders is better describes who we are. And more and more is being done in this space. A patient can also be a member, and therefore we are definitely, obviously, they are a consumer, and they could be a consumer even before they're a member and they're a patient. So the continuum of this, patient, member, consumer journey is what's how we are looking at our consumer population. So as far as things that are keenly important on the provider world, for folks on the provider side, you can relate to this. There's a lot of clinical data, diagnosis-driven data, plans, treatment plans, care guidelines and pathways, care management, gaps in care, financials, cost containment. All of those things are very relevant on the provider side. And obviously quality is another important dimension. On the provider side, the key things are going to be based on claims data, risk management, actuarial data, product pricing, product design, contract management, health and wellness, member engagement, pre-auth, things like that. But the interesting world of Payviders really brings to bear a lot of these, these points that are mentioned here. You're doing patient engagement, you're doing holistic, social determinants of care is a big thing. By merging the data sets together, you now have a more holistic understanding of the social determinant aspects of care. Patient registries, there is obviously a lot of quality studies that are happening and a lot of benchmarking that can happen through participation in a lot of patient registries. Population health, needless to say. The one important use case for us that we are leveraging this Payvider concept for is around HEDIS. As anyone in the provider on the payer world can relate to, there's a lot of money at stake, and there's a lot of need for making sure your HEDIS scores are as accurate and as complete as they can be. And as you all know, to improve your HEDIS scores, you really will benefit from having a lot of supplemental data from the clinical side. And being a Payvider and having all of this data available with something as foundational as UDMH, with the terminologies being consistent across the provider world and the payer world, it really is, facilitates as an accelerator to be able to not only bridge the data sets, but actually really highlight opportunities to improve your HEDIS scores. And truly speaking, you can move the needle to maximize your reimbursements based on your HEDIS scores. Moving on, at Baylor Scott and White, I just wanted to give you a perspective of how we look at our enterprise analytics. We look at this as a cycle, as a life cycle. So anytime there is a business problem, there's a use case, we start asking questions. Do we have the right data? Do we have the right definitions of data? Do we have the data? How do we pull all of these data sets together? How are we able to now integrate and make sure that right security controls are put in place for the data that you've just pulled in from the multiple sources? I'm going clockwise, and I just covered 1 through 4. Now you're talking about, okay, so now that I have my data, what is the use case really requiring? Is it estimating risk? Is it really being able to facilitate KPI computation based on the data that you've just brought in? HEDIS, as an example, has dozens of measures. You still have to bring in lots of disparate sources, claims, clinical, all of those things. But here is where in slice 5 is where you're really thinking about how do I compute my KPIs, and then obviously presentation of those KPIs in easy to use, access information, the visualizations. And then it doesn't stop there, right? You're constantly looking for opportunities to improve your scores based on data. How do I close gaps? How do I, what is my data telling? What are my KPI trends telling? That's where really our advanced methods and advanced analytics comes in. Now, there's a reason why we have 2 different colors here. As you can see, the blue is where we as an organization have made a lot of investments. We have a slide, the next slide, around the data integration technologies, the UDMH, all of those things really make up that blue slice. The goldish color, those are really meant to say that we are partnering with CitiusTech to leverage their BI clinical product, which really is a compilation of over 700 plus measures. We're tapping into not all of them yet, but we have an active project underway to build standardized KPIs for operational measures across the whole entire organization. Bear in mind, we are an organization that has come into existence through mergers and acquisitions, and so we have a lot of different sources. After having gone through the disciplined process of standardization, normalization of data into UDMH, now we are really, lighting up which KPIs, are important for our organization. And we are now looking to build a comprehensive metrics library on top of all of the foundational data that we have. And we are just working on about 200 plus KPIs that are focused on operational measures to begin with. But we have a vision that in the next 24 months or so, there will be a lot more measure categories that will be standardized using this approach. And that's why we kind of want to look at this work as a wheel, of analytics, because we continue to rotate that wheel across different settings, and we bring together all of these, the disciplined execution of different activities. As you can see, it's a tie-in across different areas of what we call analytics work. Our architecture, my intent is not to bore you with this, but I'll highlight some of these. We have several different data sources, right? At the bottom of the stack, we are looking at our EHRs, our lab data sources, or master data sources like EMPIs. We have our health plan data. We have our OR sources, operating room systems, or ERPs. Not only that, but we have a lot of our kind of business partners, right? We have our survey vendors. We have our additional financial systems that sometimes we have to pull data using file formats. We have data exchanges happening with third parties for registry participation, or even for reporting, things like that, public reporting. All of these things make up our kind of data exchange layer and our data source layer. And on top of that is our data integration layer. We have to have a robust enough architecture to support a mix and match of data integration strategies, right? We bring in nightly data through batch. We have data coming in real time, and we compile that data using ADT HL7s. We do go in and capture data using change capture across a variety of sources. And we have to have, and we use IBM's data stage technology to kind of help with a lot of these different types of diverse integration strategies. And we pull in XML files, we pull in text files, we connect data to the data sources directly. This goes on and on, pretty diverse ways of doing things. Now we do all of that with the target state in mind, that is our unified data model. And that, to me, is the linchpin for our entire strategy. We had to have a unified data model approach, so we are not constantly reinventing the wheel about how we are going to bring in encounter data, for instance, from our different sources, how we are going to bring in our claims data from our different sources, how we are going to bring in our patient data from different sources, right? So you take that burden off of your minds, and now it allows us with a framework to say, all right, this is my target. This is based on standards. Now, as long as I am bringing in data in these standards that conform to FHIR now or HL7 standards or what have you, you know that your model is going to be able to ingest that data. And bear in mind, we have built ETL routines that are based on these standards. So you swap one source to the other, as long as you're maintaining the data integration ingestion based on certain standards, you can scale pretty much infinitely as your business evolves or as your source systems evolve, things like that. And we have put all of that data model on our data warehouse appliance infrastructure. We are now actively engaged in looking at our options as technology evolves and as cloud is playing a significant role. We are actively going through evaluation of our options there as well. And we have very focused data marts as well. on top of our foundational data to help meet whether it's a health plan focused use case or a provider focused use case. We have data marts, or even measure library focused data marts. So we have all of those. On top of that, we have the business intelligence platform. Again, the users come in many different flavors, and the needs vary quite a bit. Some people need data using reports. Some people need actionable dashboards, exception-based dashboards. Some people need information pushed to them. Some people need information, so that they can come in and pull information. And some of it is through data sets, cubes. Predictive analytics is another thing that's an area of focus for us, as we now have most of the foundation under our belt. We are partnering with the right set of partners to come up with, and we also have some critical mass in terms of our bench strength across the organization that are looking to leverage predictive analytics. We do have some data scientists that have built some predictive algorithms that are being used in care management, in our pop health, things like that. And we obviously have actuarial. I joke around, if you have health plan and you have actuaries, you actually have data scientists. They are one of the first data scientists that you could find. And so we, as a health plan, have a lot of those. And again, not to belabor the point, there's a lot of different types of users: clinicians, financial analysts, researchers, data scientists. And we do all of this within the context of, can we make sure our data is right all the time? There is no exceptions there. Can we make sure we are making it easy for people to consume metadata? That is an opportunity for us that we have identified, is as we continue to scale our infrastructure and foundation and things like that, data governance is becoming an absolute area of need and focus for us. And in the next 6 to 12 months, that is something that we will be significantly ramping up. We do data governance right now in bits and pockets on project by project basis, but we do have opportunities where we definitely have to really take it to the next level. As far as the success that we have reaped is concerned, the focus of this is just, as a Payvider, we were on a journey to implement our integrated data warehouse, but that was purely focused on the health plan. The provider side. But we always knew, by making the choice that we made about UDMH, we knew as an organization we definitely wanted to bring in the data for our payer side as well into the data model. And hence, after we built our IDW with provider focus, we have extended that to include our payer side data as well, so that we can now sunset our health plan legacy data warehouse. That work is actively underway, is to now rationalize, and now that we have one source of truth that brings in data from the payers and the providers, we are actively looking at ways to quickly sunset our payer legacy data warehouse. And the other thing, I emphasized this point before, but we are an organization that is continuing to evolve, and our architecture allows us to swap out source systems, allows us to add new sources, allows us to bring in new sources if our organization were to continually grow through any additional partnerships or what have you. We have our infrastructure in place, and this is one of the cornerstones of how we built our data strategy. I think with that, I would say it's been great working with IBM, and can we continue to work with CitiusTech in a onshore-offshore model. And we think we are well positioned to continue to go further, to deepen our partnerships and continue to unleash value to our stakeholders. I think with that, I would say my part of the presentation is done, and I would turn it over to, I think, you, Abhay, for key takeaways.
Yes, sure. So just to summarize, right, I think you heard from Dan, from myself, and from Shashi. In terms of key takeaways, right, there are four takeaways that I wanted the webinar participants to go with. One is that, as your enterprise data warehouse strategy, no single data model is going to be enough, but a lot of times you need to start somewhere. And what IBM's UDMH really provides is that platform for all the pieces to come together. So use that as one of your data strategy if you're going into an enterprise, and if you know your needs are very varied between health systems and health plans and home health and whatnot. This really gives you an opportunity to bring it all together. The other is, as you're expanding on this, right, keep the flexibility there. Multi-tenancy is a huge issue in terms of data privacy, security, as well as access. And this really helps us in a lot of ways as well, right? So keep that flexibility there to expand into additional subject areas, additional models. We have been looking at areas like supply chain, drug distribution, and others. Very soon, I think we'll have social determinants come in, right? We have not had too many cases yet of people coming to us for social determinants, but we see that on the horizon where teams will come back and say, can we add some of the social determinants into our mix and look at that information together. Now, overall, again, we are here as a partner for your implementations, and count on us and ping us, and we can come back and help you. So net, I'm this kind of gives you a winning combination between the three parties here. With that, I'm going to turn it over to Bruce. Bruce, you want to see if there are any questions from the participants that we can help address?
Yes, thank you, Shashi, Dan, and Abhay, for sharing your thoughts and insights. We do have a few questions that came in from our listeners. I'm going to direct them to each one of you. The first one I have is for you, Shashi. How does Baylor innovate in terms of bringing speed to market? Is it more of a top-down use case-based approach or bottoms-up, building layer by layer?
I think it's a bit of a hybrid. So in our case, what happened is when we initially launched our IDW initiative, we wanted to drive some focus and based on where the greatest need and impact is. And once we realized that a lot of those high value use cases required a strong foundation to be in place. So we said, the common thread that runs through all of this is let's build the foundation, let's invest in the right stack, let's make sure that we brought in the critical mass needed. And now, once we have the critical mass under our belt and we delivered on initial use cases, as use cases now come through additional top-down execution in alignment with our overall strategy, with the foundation that we have, we are now complementing, supplementing, augmenting whatever additional things are needed to try and meet the needs of the business. So it's a continuous cycle of improvement based on the critical mass that we have been able to amass based on the foundational effort that we have been able to bring forward.
Yeah, thanks. Bruce, any other questions?
Yes, thanks, Shashi. So the other question that I have here, Abhay, I'm going to direct this to you. Does CitiusTech have tools to accelerate the UDMH implementation and build analytics on the top of it? And does CitiusTech offer both services and solutions, either of them?
Yes, that's correct. So we do offer both services and solutions, and in terms of accelerators, I did cover some of that in few slides. What we really bring to the market is not only services, but a lot of time you don't have to start from the scratch. Since we have done this at other customers, it helps to bring in that acceleration in terms of data integration, accelerations in terms of analytics, acceleration in terms of kind of packaged clinical quality measurements on top of UDMH and others, and an ability to scale up, right? Ability to see this on time, right? One thing that I missed stating earlier was along with one thing that we have seen with Quest, the amount of data wise that in the prior versions on the teaser, we were by far the largest or the fastest quality measurement engine on top of that, right? So all of that kind of brings a nature of a mix of services and packaged solutions to the mix. So I hope that answered the question, but you'll find a lot more on our website, and feel free to contact any of us for details.
Thank you, Abhay. And so one more question that we can take up, keeping in mind the time that we have. This I will direct to Dan. Where and how does UDMH stand in the new offerings from IBM, the hybrid data management cloud initiatives?
That's a good question. So as you know, the IBM Analytics portfolio has a hybrid data management offering, a unified governance and integration offering, and of course a data science offering. And all of these are now available, for cloud deployment as well as on-prem, kind of a hybrid deployment solution as well for those who have a mix. And really, IBM's strategy for across these portfolios is to enable our clients to really know their data better, find it, trust it, get it in a place where you can trust it, which talks about governance, and then of course being able to use the data properly. So in terms of that strategy, one of the things that you should keep in mind is that regardless of what portfolio, what product you're using in analytics, IBM is moving towards that focus around an enterprise information catalog, a smart catalog. The idea that the information within a governed catalog or a curated catalog can help you not only govern your data, but be able to do more and more about mapping, start automating the processes that for years organizations have wanted automated. How do you do automated ETL? How do you do automated discovery? How do you do automated reporting? How do you advise the IT staff as opposed to have them constantly maintaining data, right? So the only way you're going to get there is by adding intelligence into the catalog that governs your data. And that's where the industry models really play a part. I'm talking about UDMH as well as the other industry models that we have for the industries. Because we bring the industry insight and content already in the catalogs, in the vocabularies, already residing in our governance tooling, we're able to now influence the entire portfolio as we move that technology forward. So that's the role that models are playing more and more. They're playing more of an integrated role in influence the capabilities.
Thanks, Dan. So I think we've covered pretty much all the questions that came in. A big thank you again to you, Shashi, Dan, and Abhay for addressing this interesting topic. Once again, like Abhay mentioned, I would urge each one of you to please reach out to us using our website or via email. We'd be more than happy to take up any questions or share more feedback based on your what you've heard from today. So with that, I'll sign off from today. Thank you so much for joining us, and have a great day ahead.